What I am learning is that people need and thrive on simplicity. So if we're thinking of how we can do things to support our patients and to support our nurses to change their practice and to change their lives, it needs to be simple and it needs to be a repeatable process that anyone can implement no matter where they are. This is where I think the beauty of nurse coaching comes into play.
Nurses, nurse coaches, welcome back to the Nurse Coach Collective podcast. Heather and Peter here. Today, we're going to talk about something a little different. We're going to talk about hope. We're going to talk about excitement. We're going to talk about all of the potential for what we can have as a country and a population and a nation of healthy individuals. And there's nobody better to get us stoked and excited about it than you, Peter, because this is an interesting moment right now. Like, there's a lot of people who are feeling uneasy, right? It's a high political time. There's a lot of division going on. And yet you are feeling hopeful. You're feeling excited and passionate and like more excited than ever to be a nurse coach and be a part of this movement. So is it okay if we talk a little bit about that and can kind of dive into your mind?
Y'all, before we jump in, I want you to know this is not a political discussion. Nothing to do with any of that. This is about what is actually happening right now and why, truly, in my heart of hearts, like, I actually think that nurse coaching has been waiting for this moment. So I'm personally pumped. So yeah, let's get into it. And I was laughing when you were like, let's talk about something hopeful. Let's talk about something aspirational, something different for a change. And I was like, yo, that's what we always talk about. We're always talking hope. We're always talking aspirational. Yo, we see the world through rose-colored glasses because it's more fun. Whether you're an optimist or a pessimist, you're right.
Peter, talk to me about first, like, what are you seeing right now that isn't working? So like, paint the picture of where we're at right now when it comes to health as individuals, as a population. What do you see?
Health is spiraling in the absolute wrong direction. When we first started as nurse coaches, a lot of the statistics that were current about how many people have a chronic disease, right? It was hovering below 2/3. Less than 2/3 of people had one or more chronic diseases. Less than 2/3 of people were on a prescription medication. Less than half of people were either obese or overweight, right? Fast forward only like 7 years, and those statistics have gotten absolutely out of control. So now we're like borderline on 3/4 of people are having one or more chronic conditions. 3/4 of people are on one or more prescription medications. Almost 2/3 to 3/4 of people are either overweight or obese. More than half of kids aged 15 are experiencing one or more chronic conditions. Like, it's absolute madness. So this current state of healthcare and health inside of our nation is absolutely just spiraling out of control. And you have to like zoom out and start to ask, like, what the hell is going on, right? How do we spend more money on healthcare than literally every other nation? We spend so much money on healthcare, and yet we are just deplorably sick as a nation. And I do not want to hear the excuses that people just want to be fed a pill. They just want to be sick, that they don't actually want to be healthy, because it is BS, right? Nobody wants to be sick. Nobody wants to be unhealthy, especially chronically, right? It just doesn't feel good. You feel weak. You feel like a lesser version of yourself. And all that compounds to just a life not well lived. And humans, we want to live good lives. So, when I step back and I look at it, I'm like, man, just don't think 4,000 nurse coaches is going to cut it. I think we need something bigger. We need a bigger force of wellness inside of our current model. And we have to start, fighting back at every single opportunity that we can, because the pain is also being reflected inside of the nursing profession in such a profound way. We talk about these numbers like they're just numbers, y'all, but it shouldn't be normal for 90% of nurses to be burnt out. It should not be normal for nurses to be more unhealthy than the average American. That doesn't have to exist as a normal inside of our profession. And so not accepting this as like our ultimate fate is step number one. And I know I'm getting ahead of myself here, but really, when I see the problem of healthcare, health inside of our country is compounding. It's absolutely out of control. We're just giving people worse and worse food, and then we're having to give them, more and more medications. And then on the provider side, we're just so out of alignment with the work that we're providing, because we're like, I didn't get into this for this reason. I got into this work to actually help people to heal, to help people who are acutely injured or who need modern medicine acutely. Yeah, hell yeah, I'll give them the miracles of modern science, but something needs to change, right? So that's the problem as I see it.
Yeah, that's the problem as you see it, but also like backed with the facts, backed with statistics that we have literally been watching rise before our very eyes. And you and I just had a perfect opportunity to see the contrast of what can happen over just the course of half a decade, because we completely rewrote our entire course, re-researched all of the most up-to-date evidence, and rewrote our entire book. So we literally got to see, by going through and replacing statistics for what was the number 5 years ago and what it was today, and what's the direction that we're moving in. And so we see nurse coaches making all of these incredible strides, but the population as a whole is spiraling itself into this deeper hole. And the profession of nursing, as you're describing, is also spiraling itself into this deeper hole. So, okay, that's what we're looking at right now. That's what we've got to work with. We have our work cut out for us. So where does hope come in? And how are you in this moment able to put on not just rose-colored glasses, because that implies a false sense of optimism and positivity, but where are you seeing hope? Where are you most excited right now? And like, why now in this moment is all of that coming to the surface for you?
Nurse coaching is inherently a hopeful and positive model, right? You have to believe that somebody is capable of change and making positive changes in their life in order to be able to sit down and have a conversation with them about it. I have been training myself for years and years to see hope and positivity and the capacity for humans to change. And I know it to be true because I've seen it happen with our students and with the tens of thousands of people that they've had the opportunity to work with. I know Make America Healthy Again can be for some reason, it is a polarizing issue. For me, it really feels like a nonpartisan issue. And if I'm being totally honest, it's what I've been working towards for almost a decade of my life. So the fact that people are saying this on the regular is so exciting to me because the outcome can only be better, right? If we're actually striving towards true health and true wellness as a country, the outcome can only be beneficial to all parties involved. Yes, we're going to make some deviations that maybe aren't perfect or maybe aren't the right way. But I truly believe by having that sentiment of a desire for hundreds of millions of people to be more well and to be healthier, the only outcome can be happier people, healthier people, people who are more productive in their life, people who enjoy life more. And, as a community, what an awesome thing to be striving towards. And when I look at how we're actually going to get there, the number one way that we can get there and really begin to achieve that, I truly believe this in my core, is through nurse coaching. All the time, I'm seeing a doctor come out with a new protocol, right? So this is this protocol. And if you follow this exact protocol, your whole life's going to change, right? Or another wearable or one of those little devices that you stick a tiny little micro needle into your arm and now it measures your blood sugar and it tells you exactly how much you should be eating exactly when. And it's
very, very cool, amazing technology.
Super cool.
But not the
Love
root
it.
cause.
What I am learning is that people need and thrive on simplicity. So if we're thinking of how we can do things to support our patients and to support our nurses to change their practice and to change their lives, it needs to be simple and it needs to be a repeatable process that anyone can implement no matter where they are. This is where I think the beauty of nurse coaching comes into play because it is the intersection of lifestyle medicine, which can prevent, treat, and reverse 80% of diseases, with coaching psychology, which is how you go from, everybody should be doing this. Everybody should be eating better, should be sleeping more, should be exercising more, should be practicing mindfulness to have less stress in their life, should be having more connections. We talk about shoulds all the time, y'all. We don't need any more talking about the shoulds. We need talking about how the hell do you actually help people to do that? How do you hold people accountable? How do you provide them with coaching to make those small changes that very quickly can add up to transformative changes inside of their health, their well-being, and their happiness so they can get off their medications, so they can begin to achieve a far healthier weight, so they can begin to not feel so stressed and so anxious and so depressed and lonely all the time. We have the solution. It is right in front of us. But what I'm beginning to realize is maybe we haven't talked loud enough. I don't know. I feel like so many nurses don't know this solution exists yet. And so that is my work cut out for me, is like, how can I really begin to bring this to not 4,000 nurses, but 40,000, 400,000? Because if we're looking at what is the path to truly begin to make America healthy again, Lord, it is not something that's more complicated. It is sitting down with our patients. It's having conversations about what is going on in your life holistically, and how can I support you to do the things that you need to do in your life to be healthier, starting right now and then for years and years to come. Each person that we get to work with, it begins to be this like spiraling of events, right? It's this ripple effect, the butterfly effect. One healthy person in a family we know is just going to begin to make everybody else healthier. Sometimes it takes weeks, sometimes it takes months to begin to catch up, but that's how this whole thing works, y'all. And I don't care where you fall in the political spectrum. I truly, in my heart of hearts, don't. I actually can't believe that this is a statement that is being said regularly. It will shift the mindset, right? The whole mindset of a population can shift quite quickly to begin to go in that direction. And as I said, we're going to have some hiccups. We're going to have some road bumps. We're going to do some things that are way too complicated, but that solution of nurse coaching can come in, and it will be one of the most effective paths to truly making our population healthy and well and happy, and making us nurses feel like, hell yeah, I'm excited to be a nurse and I'm happy to be a nurse.
Well, you said, I feel like maybe we haven't been talking loud enough, which, I'm always over here saying, I got to scream from the rooftops and tell every single nurse about nurse coaching. But you're right. I mean, there was a big part of me even talking about like this topic today, which ultimately is the core of why we do the work that we do. And even I came into today's conversation with some fear, with some feelings of reservation, with feeling like, well, I don't want to say anything that could get tied in with politics in any way, shape, or form. And the beauty of your perspective that you always bring is like, hold on a second, let's tease everything apart. The word health, the word healthy is right now moving to the forefront of everybody's mind. Like, we're talking about creating more policies that have to do with creating a healthier population, and just like taking a good, hard, raw, honest look at that. And is it always going to go in the right direction? Nope, of course not. It never is. But the fact that we're having conversations about it, and that everyone is thinking about this, and it's becoming the spotlight, can only be a move in the right direction. Because what's the alternative? The alternative is, let's go back to the first thing, the first thing that I asked you. The alternative is staying exactly where we are now. And is that working? Oh my goodness, no, it's not.
Being healthy and of a reasonably healthy weight, and having decent mental health, that shouldn't be the outlier. Like, you have failed your entire population. The food system, the healthcare system has failed our entire population. There's a propensity to try to make this a partisan issue in so many ways. If you slow down and you zoom out for a second and you just look at like, okay, if we just take that out of the conversation and instead focus on, Lord, we have to be doing something differently. And we understand that we have this model of nurse coaching, and it is such an effective path to really support and to help people. I could not be more stoked. I could not be more excited to have the word health just come up again and again and again in front of people, because it's reminding us that there is a different way to live and there is a different alternative, y'all.
And that there is hope. And that I think the reason why you and I have been able to maintain hope and excitement over this last decade, regardless of the trends that we're seeing in healthcare, regardless of chronic disease continuing to rise, regardless of nurse burnout continuing to rise, is because we have also simultaneously seen so many nurse coaches in action, and the lives that they touch, the people they support, the ripple effect that has. So we've seen the proof. Like, we have seen the answer, we have experienced it in real life, and we have watched it get out there and work its evidence-based, science-backed magic in action to help people reclaim health. And that's not something that you can do for anyone. That's something that you can co-create with them and then give them the tools to continue to do that, to be the owners of their own health and their own life. And there is nobody on this planet who does not want that.
Y'all, if you're listening to this, here's what I want you to hear. A lot of times it can feel like the system is entirely stacked against us, against the odds. The Nurse Coach Collective has really been a pocket of resistance for the past almost decade at this point. And we do that by each of us in our little communities, in our little families, hospitals we work in, whatever we do as a nurse coach, we do that by showing up differently and providing those little moments of resistance against something that is so completely and utterly insane and out of alignment with true health and happiness. So y'all, be those little pockets of resistance. Don't be afraid to show up differently in your life and in your practice, because things can change really, really quickly. It will not take long for the trend line to begin to reverse. I truly believe that in my heart. The first step in the process of change is awareness. And so that's why I'm so excited about, these words that are flying out around there to make us healthy again, because it is awareness that like something is truly, truly wrong and broken, and that there is a path to health and to happiness. If you haven't dove into nurse coaching yet, for the love of all that is holy, please put this into practice. We have so many free resources to help you do that. I don't care how you get involved, one way, shape, or form in the other, but be part of this grassroots movement towards systemic change inside of healthcare, because it is the most fun, hopeful, and exciting thing happening inside of healthcare right now, y'all. So thanks for listening to your boy here, being super pumped about this movement that's happening and truly being able to be a part of it.
Exactly. And not just because you're seeing it happen and you're seeing people get excited about it, but because you are living inside of it, surrounded by thousands of other nurse coaches who are right there with you, realizing that this is the moment that we've been waiting for. So let's seize the opportunity and let's grow this movement. Let's make it as massive as it can possibly become, because health is attainable. It's not some impossible thing for us all to have as individuals and as a nation. We have all of the money, all of the resources, all of the technologies, all of the amazing gifts that Western medicine has given us. Now it's time to do exactly what you said: simplify. Simplify and come back to our roots and do the things that we absolutely know are necessary to create health. And that's where nurse coaching comes in. That is our literal forte of our superpower of what we get to do in our own lives and for others. So Peter, thank you for letting me crack into that brain of yours a little bit today. Thanks for sharing your hope and your excitement. And for our listeners, I hope some of that hope and excitement is feeling contagious. You get a little dose of what's going on in the Peter Giza mind, and you're welcome.
See y'all in the next episode.
Thanks for joining us. We'll see you next time.